Affordable hair growth. Affordable and hair growth, come on, those don't go together. Pretty much everything for hair growth is super expensive, a pain. We're gonna talk about good old minoxidil. And I know what you're thinking. You have talked about minoxidil ad nauseum. We already know about that. We know minoxidil is FDA approved for androgenetic alopecia, aka pattern hair loss in both men and women, and we don't want anything to do with it, or we're already using it. It's messy, it's irritating, it's annoying. Why did I click into this video? Well, we're gonna actually talk about taking minoxidil by mouth, oral minoxidil, versus applying it to the scalp. There are a few reasons why you and your doctor, I'm not your doctor, but you and your doctor might consider oral minoxidil over topical minoxidil. So minoxidil is actually kind of a neat drug. Back in the 1970s, it was FDA approved for severe refractory hypertension, high blood pressure. It works by dilating blood vessels. It's a vasodilator. It had this side effect that started popping up of unwanted hair growth, and people thought, don't let a tragedy go to waste. Let's rework this into a hair loss medication. Boom, 1980s, you get minoxidil, topical minoxidil, that you put on the scalp for androgenetic alopecia, which is just one type of hair loss. Remember, there are many types of hair loss out there. Now, that being said, minoxidil ended up being helpful for other types of hair loss we found throughout the years. But anyone out there who has used minoxidil, comment below, the topical stuff that you can buy over the counter without a prescription. You know, it's got its challenges, all right? It's not perfect. It has its pluses and minuses. If you get in the habit of using it, it can really yield substantial results. Not everyone responds to it, but when you do, you know it's working, and if you're motivated to keep up with it, it's actually really rewarding. It's the most evidence-based hair loss treatment that you could buy without a prescription. How exactly does it work? We don't 100% know how it works, but there are a few ways in which it probably works for hair loss. It's a vasodilator, so it improves circulation to the hair follicle, which is really important because growing a hair is very energy demanding. You need delivery of growth factors, micronutrients, all of that stuff. Minoxidil also helps to stimulate pathways that are important for hair growth, specifically Wnt beta-catenin. Minoxidil also has some anti-inflammatory properties, and a lot of hair loss disorders have inflammation as part of the underlying process that drives the hair loss. Minoxidil may even, to a certain extent, inhibit that enzyme 5-alpha reductase, which is really important in sort of the hormonal aspect of hair loss. And it seems as though minoxidil extends the growing phase of the hair cycle anagen. So basically, it gives the hair follicle an opportunity to be in the growing phase so you can get a longer hair. Why in the heck would you even entertain the idea of taking a pill when you just put something on your head? Well, there are a few reasons. First of all, it ends up, in many cases, being less expensive to take a pill by mouth. Generic minoxidil, the doses used to treat hair loss, pretty inexpensive, anywhere from 10 to 20 bucks a month. And if you're asking, why would I want to take a pill by mouth versus putting something on my scalp? To that I say, have you ever used minoxidil? Comment below. For a lot of people, it's annoying. You have to put it on twice a day, and that's a lot to keep up with. Minoxidil can be messy, and actually for some people it can change their texture of their hair and make it difficult to style their hair the way they want to. It might be greasy, it might weigh the hair down. People like the idea of taking a pill versus having to spend time working minoxidil into their scalp twice a day. One of the most common adverse side effects of topical minoxidil is that it can cause scalp irritation, a contact dermatitis, and this can actually worsen hair loss to a certain extent by, well, causing more inflammation in the scalp. And a lot of people have underlying scalp disorders like seborrheic dermatitis, atopic dermatitis, eczema, psoriasis, which can be aggravated by the irritation from minoxidil and limit their ability to use it. The other reason is maybe you didn't really respond so well to topical minoxidil, like maybe you didn't really see much of a change. One possible reason for that is that minoxidil is not actually in its active form. In order for minoxidil to work, it actually has to be converted to the active form by something called a sulfotransferase. When you apply it to the scalp, the sulfotransferase enzymes are located down in a part of the hair. But for some people, unfortunately, they don't have good levels of that enzyme there in the hair, or it's just not super active, so they don't end up responding to topical minoxidil. When you take minoxidil by mouth, it's absorbed in the digestive tract. In the liver, it gets activated to the active form. So you may respond suddenly to minoxidil when you start taking it by mouth. mouth versus putting it on your scalp due to differences in that sulfur-transferase activity level in the scalp versus the liver. Here's another reason why you might be more intrigued by the oral medication versus the topical. Minoxidil is toxic to dogs and cats. So the topical minoxidil residue, maybe on your hands or even on your face, and your pet licks your face, that amount can even be toxic to your pet. So a lot of dog and cat owners are rightfully so afraid to use minoxidil, that they could be causing harm to their pet. A lot of people even sleep with their pets in the bed, and you put the minoxidil on at night, it might transfer to your pillowcase, and that could be bad news for your pet. You don't have to worry about this with oral minoxidil, provided of course the pet doesn't get into your minoxidil pills and end up ingesting them. It's a lot easier to keep your pet away from your minoxidil pills than it is for you to keep them from licking residue off of your skin. So it might be cheaper, less irritating, less headache to put on and utilize, and if you have pets, less of a hazard to them. And in a lot of cases, you might even get more substantial or better results with oral minoxidil compared to the topical stuff, maybe because of differences in that enzyme activity or just overall uptake into the follicle. Before you click out of this video, taking minoxidil by mouth, it's not all sunshine and rainbows. It's a pretty safe medication, provided that it's dosed appropriately, and we'll get into that later. But there are some other side effects that you might want to be aware of with oral minoxidil compared to putting minoxidil on your scalp. Now, if you've ever used topical minoxidil, you know that it actually increases hair shedding in the first couple of months of use. This is perfectly normal because it's kind of rearranging the hair cycle. Same thing happens when you take minoxidil by mouth. You can experience an increase in hair shedding in the first few months of starting oral minoxidil, same as with the topical minoxidil. They don't differ in that regard. If you've ever used topical minoxidil that you apply to the scalp, you may have gotten some hair growth like on the sides of your face. With oral minoxidil, hypertrichosis, hair growth on the body, the face, is a lot more common of a side effect. It can be a wanted side effect or an unwanted side effect. For women, they typically don't want to have facial hair. The other thing that can happen with minoxidil that you take by mouth is, remember, it is a vasodilator. It causes the blood vessels to dilate, and because of this, you might feel a little lightheaded, get some dizziness, perhaps a headache, and you may have an increase in your heart rate. This varies a lot depending on the dose, and if it's going to happen to you, you're going to experience it usually within 3 to 7 days of starting the medication. So that's a side effect to watch out for, and of course tell your healthcare provider if you are experiencing. The other possible side effect is fluid retention, salt retention, and as a result, swelling in the lower legs, the face, especially around the eyes. If you step on the scale, your weight might be up due to fluid retention. The fluid retention side effect tends to come and go and get worse with consuming a lot of salt in your diet, or if you get sick, or with certain medications. It's also possible to experience headaches on oral minoxidil and insomnia. So these are the possible side effects. Doesn't mean that everyone gets all of these. The most common one is hypertrichosis, and again, to a certain extent, that might be a wanted side effect. Maybe you want more facial hair growth, or maybe you don't. And also remember that when you're prescribed this, you're following up with your doctor. So a lot of people hear some of these side effects and they're like, no way, never, ever, ever, totally afraid of that. I do not want to have that. But it would be a side effect that you would be monitored for, and the dose of your medication could be adjusted to do away with the side effect, or you could stop it and the side effects, are reversible. It's not as though the hair that you grow is permanent, which brings me to my next point. Just as with topical minoxidil, oral minoxidil, you do need to continue to use in order to maintain the results. It's not a cure for hair loss. What type of hair loss does oral minoxidil work for? Now remember, there are many different types of hair loss out there. Topical minoxidil is FDA approved in both men and women for androgenetic alopecia, the most common type of hair loss, influenced by your hormones and genetics. You get miniaturization of the follicle, and you get thinning in a pattern distribution. Just like topical minoxidil, oral minoxidil can treat androgenetic alopecia, although it's not FDA approved for that. Oral minoxidil can also be pretty helpful directly for a variety of other hair loss disorders, including telogen effluvium, which is excessive hair shedding, traction alopecia. Remember, I've talked about that. I've got dedicated videos on different hairstyles that can cause hair loss, age-related thinning. It also can help with the autoimmune hair loss disorder, alopecia areata. I have a video on that. Some patients who undergo chemotherapy, they lose their hair and they have persistent alopecia. It doesn't grow back. Oral minoxidil can help with that as well. As a side note, I have a video all about skin and hair care during chemotherapy. Check that out if you are going through chemotherapy. I give a lot of pointers in that video. Some patients have to be on hormone therapy that leads to hair thinning, hair loss. Oral minoxidil can help with that as well, directly. And oral minoxidil can provide a supporting role in the management of lichen planopilaris, an inflammatory hair loss disorder I have a video on, as well as frontal fibrosing alopecia, which is kind of a variant of lichen planopilaris, where you have a receding hairline. Definitely check my video out on that, especially if you're noticing that your hairline is receding. Don't ignore it. Could be that. Central centrifugal cicatricial alopecia. So now that we've covered the types of hair loss that oral minoxidil can help in treating, as well as the side effects and why one might want to consider with, of course, their healthcare provider, oral versus topical minoxidil. Who is oral minoxidil off the table for? Like, who is this a no-go for? Well, if you're taking a medication that interacts with minoxidil, then, you know, that would not be indicated. If you have a problem or have had a problem or you have a buildup of fluid around the heart, not a good idea to take oral minoxidil. If you have congestive heart failure, this is not a good idea, not indicated. If you have pulmonary hypertension as a result of something called mitral stenosis, not a good idea to take oral minoxidil. If you have had something called a pheochromocytoma, not a good idea to take oral minoxidil. If you are pregnant or breastfeeding, no oral minoxidil. Now, there are some people who can take oral minoxidil, but with caution. They should be monitored more carefully, maybe have some blood work, maybe have an EKG. People who have a history of arrhythmias or an elevated heart rate want to be real careful. Not off the table, but need to be very cautious. People who have low blood pressure, hypotension, remember this is a vasodilator. It originally was a blood pressure medication, so want to be cautious with people who have low blood pressure. And anyone who has impaired kidney function or someone who is on dialysis. Many of the side effects that we have covered in this video with oral minoxidil are often dose dependent, meaning the higher the dose that you're on, the more likely you are to experience a side effect. When it comes to treating hair loss, we actually use a low dose. Low dose oral minoxidil is what is used to treat hair. What do I mean by low dose? Anywhere from 0.625 milligrams to 5 milligrams of minoxidil. This is in contrast to the doses that would be used to treat hypertension, high blood pressure. The doses used to treat high blood pressure range anywhere from 10 to 40 milligrams of minoxidil. And because we're using such a low dose, changes to your blood pressure are very unlikely with oral minoxidil for hair loss at this low dose. Higher doses, what are used to treat high blood pressure? Yeah, that can bottom out your blood pressure for sure. Not something that we see though, using the doses that we do to treat hair loss. When it comes to dosing, only your healthcare provider can determine what the best dose is going to be for you. A lot of things are going to influence that. The doses for women are lower than for men. And it also will depend on the overall severity of hair loss that you're dealing with. Maybe you need a higher dose to get results. And dosing will also be adjusted depending on your acceptance of hair growth, say on your face. Like I said, some people really want that and are okay going higher on the dose to get more hypertrichosis on the face, as opposed to other people who are like, oh, no, I can't handle this. Then, you know, trying for a lower dose. How do you know if it's actually going to work? The earliest you start to see results with oral minoxidil, 3 months. Remember, when you take oral minoxidil, just like when you use minoxidil directly to the scalp, the topical minoxidil, you often can expect a period of increased hair shedding. It's not true permanent hair loss. It's just the hair getting kicked out of the follicle to make way for new healthy hair growth. It's a good sign. It means the drug is working. But it's kind of annoying and it's something you should be aware of before starting these, because otherwise you might get freaked out. Oh my God, why is my hair falling out? It's not. It's just that comes to an end around 3 months, and that's really when you can start to see an improvement in hair growth, hair density. But some people have a lot of hair shedding and it might take 6 months to begin to start seeing results. I know what you're probably wondering at this point. How does topical minoxidil compare to oral minoxidil? Like, is oral minoxidil better? It kind of depends. And we honestly need a lot more research comparing the two in different regimens as well as in different age groups. But it does seem as though oral minoxidil can be more effective, and a lot of that might be influenced by the type of hair loss that you have, as well as, again, that sulfur-transferase activity, etc., etc. Here's the other thing to keep in mind as well, is that low-dose oral minoxidil often can be combined with other hair loss treatments, perhaps yielding better results than maybe anything you've ever tried before. For example, a lot of men with androgenetic alopecia might be prescribed finasteride or dutasteride. These are medications that inhibit 5-alpha reductase, that enzyme that plays a role in the hormonal aspect of androgenetic alopecia. These medications can be combined with oral minoxidil. Again, no topical involved, a lot easier to keep up with, and you can get pretty profound results in those situations. treatments. You also can combine oral minoxidil with low-level laser therapy. Not inexpensive to do at home, but there are options and something a lot of you guys have even started doing and seeing results. So in summary, oral minoxidil is a safe and effective and inexpensive hair loss treatment, evidence-based. While you often hear a lot of coverage on topical minoxidil, oral minoxidil is not often spoken about. And I think it's something, if you are dealing with hair loss, it's worth knowing about, hearing about, having some background information on. Even if you have no interest, at least having that information in your back pocket, I think can be hopefully useful to you. Now, speaking of other inexpensive things that can help with hair loss, maybe not cure any type of hair loss for sure, but certainly may help with healthy hair growth, is scalp massage. And on the end slide, I'm going to put my video all about scalp massage for hair growth. Check that one out next if you are so inclined. But if you guys like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.